Dogs make the best companions for humans. This podcast aims to help make humans better companions for their dogs. Welcome to the Baru Podcast, a modern lifestyle podcast for dogs and their people. I'm your host, Charlotte Bain. I've been caring for other people's dogs for more than 15 years. And while I've learned a lot in my career, I definitely don't know it all. So I've collected an ever-evolving roster of amazing dog people. And I learn new things from them all the time. In this episode, I get to chat about one of my favorite subjects, senior dogs. Today I chat with Dr. Tori Countner, founder of Balanced Pet Vet. Dr. Countner is an integrative veterinarian who combines natural methodologies with Western medicine. She specializes in pain management, nutrition, and senior care. We chat about some of the issues we can be more mindful of when it comes to our senior dogs, as well as some of the ways we can support their quality of life during the aging process. So let's jump in. I really want to talk about senior dogs because I think we don't think about that until it's time, right? Until we start seeing some changes in our dogs. And I know my guy is almost 15 now, and I really didn't notice how much he was slowing down and how all the things that were cropping up until he was like 12 and things started changing. And I'm sure it was kind of building way before then, you know. First of all, like, if we can just jump in, like when is your dog a senior dog? Because I've heard mixed things.
Yeah, it depends on the size of the dog and sometimes the breed of the dog. So smaller dogs tend to live a little bit longer, so well into their teens. So usually senior age is around, we'd say like 12-ish. So that's kind of on point with your dog. Bigger dogs, unfortunately, they don't live as long. And so we consider 8 or 9 years old to be a senior dog and bigger dogs. That's, to say that, some other breeds can have some differentiating factors, but that's usually the basic rule of thumb is the smaller the dog,
Right.
The longer they'll live. So
do we know why that is other than just body mass? Is there any research done on the reason behind why the little guys?
Yeah, it's mainly, I think a lot has to do with body mass and just the rate at which they grow so quickly. I think that has a lot to do with it. I haven't looked into any studies as to why. I know, for example, Bernese Mountain Dogs, they used to get a lot of cancer, so like bone cancers, and so that shortened their lifespan. A lot of breeders are trying to breed that out of them, but they still have a pretty short, lifespan. So I think it's pretty much like the rate at which they grow, and smaller dogs don't grow as quickly and obviously as large as the bigger breeds do.
Yeah, they put a lot of work in early on. It probably catches up with them. Yeah,
exactly.
Those first 2 years, like so much happens.
Exactly.
So,
yeah.
I've noticed so many changes with my own dog. Things like his appetite's changed. He's slowing down, and the more I read, the more I find that those are common things. And I wanted to just talk a little bit about that, like how we can support our senior dogs through those kinds of changes. What are some of the things that you see?
Yeah. So a lot of clients come to me and they say, oh, he's slowing down, but I know that's just old age. When in reality, slowing down can mean a number of things. Usually it means arthritis or some sort of pain in their body. So putting them on a good joint supplement, especially our larger breeds, I usually recommend that before they get to the senior age. So, for our bigger dogs around 2-3 years of age, our smaller dogs, they can wait a little bit more. Yeah, especially if they're active. Like I'm seeing a lot of Huskies and, German Shepherds that are younger. And so I talk to clients about that just to kind of decrease the progression of arthritis. That slowing down can mean, pain, arthritis, that type of thing. It could also be heart disease. A lot of our dogs, some of our smaller dogs, they're more prone, or I see heart disease in them a lot more. And so they have what we call exercise intolerance, where they can't get enough oxygen in their body pumping through. And so they tend to slow down on walks. It could be a number of factors, but those are the two main ones that I see. Appetite, that could be again a variety of things. A lot of times it's dental disease. So pain in their mouth, or it just feels really uncomfortable. It doesn't have to be like a sharp shooting pain, but just kind of a like a dull pain in their mouth. A lot of our senior or adult dogs have bad dental disease. There could also be some changes with the kidneys or the liver that they could just not really feel great, especially in the morning. I find that our senior dogs don't love eating breakfast, but they'll eat in the afternoon or dinner.
I've noticed that with my own guy. It's hard to get him going in the morning on breakfast. And so now we usually do it around like 10 or 11 now, because normally when we get up at like 7, he used to eat and then come with me for the day. I can't get him to eat in the morning. And I've always wondered if it was like nausea or, it definitely takes a while for everything to kick in, I guess.
Yeah, it could be all of those things. Usually the underlying cause is a little bit of nausea, or pain. So, like oral pain, nausea. I know it's counterintuitive to say, well, he has nausea in the morning because of like having an empty stomach, and you would think that they would want to eat. But that could be the case sometimes. And then they're just not ready until, like 10 o'clock with your guy or in the afternoon.
Because they do get things like acid reflux and like acid stomach. Yeah.
They do. Like yeah, exactly. Just like us. So, that definitely could be a factor. So just, being aware of that and kind of saying, okay, well, he may not eat until 10 a.m. So that's when we'll feed him, and just making sure that there's nothing else going on. So, going to your vet, of course, and doing some blood work just to check out the kidneys, liver, red cells, white cells, just make sure there's nothing going on that could be causing this. And then ideally taking a good care of their mouths, which I know is hard to do.
So hard. I'm super guilty of not. That's the one thing. And I've really, over all these years, have had a hard time. When he was like 2, I was gung-ho about brushing his teeth, and then that kind of filtered off. Yeah.
I mean, me as a vet, I go through phases too. One of my dogs just had a dental, and it's the 2-week mark tomorrow. And now I have to start brushing his teeth because, we let his mouth heal. And, I have to set a reminder in my phone because it fell out of our routine, but it's so important. So I need to get it back into the routine before it becomes a big issue. But it's hard. And I know I sympathize with my clients. There are toothbrushes, there's finger toothbrushes, there's also dental wipes that are a little bit easier to use. So ideally we do it 3 to 4 times a week, but I tell my clients
I thought you were going to say day.
3 to 4 times a week. So I tell my clients, if you do it like once a week, or just like once on the weekends and once during the week, that's awesome. Just a little bit can help for sure.
And ideally, we should be doing this before they become senior dogs, I suppose. But yeah.
Yeah. And also talk to your vet about doing an anesthetic dental, or if there is a non-anesthetic option as well, talk to your veterinarian about that. I definitely think a deep cleaning before they get to the senior age and before they're a little bit riskier for anesthesia, I think that could do wonders for their oral health and systemic health as well.
I've read different things about doing the non-aesthetic teeth cleaning. From what I read many moons ago, which is not worth it because it doesn't really get deep in there. Maybe it's changed over the years, but what are your feelings on that?
I agree. It's if that's the only option, and then I'm okay with it, but it's not the option. We can't get under the gum line. If they're stressed out, sometimes a lot of dogs tense up their muscles and then tweak something. But if it's the only option, I'm okay with that. But I definitely talk to clients and make sure we exhaust all the other options in terms of an anesthetic dental, really brushing their teeth and getting in there. So it's not 100% off the table for me, but I would rather do a full anesthetic dental way we can get x-rays and clean underneath the gum lines and really get a good sense of what's happening in their mouth.
Do you think that, so you were saying that, one of the most common things that you see in aging dogs is arthritis and mobility and pain, right?
Yes.
And I know you do alternative methods. You do integrative
Yeah.
methods to help deal with that. What are some of those things that, people can look into either with
Yeah.
options to keep their dog moving and grooving?
So acupuncture I love because it basically helps to balance the body all around. It helps with pain. It helps with waking up their nerves. So if they have a little bit of decreased nerve stimulation, acupuncture is a great way to hit all of those, like check all of those boxes essentially.
Hmm.
It's non-invasive. Yes, you put tiny needles in, but they barely feel it. And the worst thing that happens is that nothing happens, meaning that there's no crazy side effects. So that's why I love acupuncture. There's also physical therapy, which can be done in a facility, or some veterinarians come to your house and they can teach you how to do different exercises specific to your dog's needs. So that's a great avenue to look into some veterinary PT options. Laser therapy is also great.
What is laser therapy? Sorry.
So it's basically photo biomodulation where it sends like energetic waves through the skin and it targets cells to whatever body part that you are working on. So, for example, hips. I work on a lot of
Yeah.
hips, and so it basically sends light or like a wavelength of light to that area through the laser, and it's calculated based on the dog's weight, the coat color, the area that you're treating. So it gets in there and it helps the healing process. It helps to decrease
Hmm.
pain. It helps with
Hmm.
inflammation and bringing in good cells and, taking away waste products. So it's similar outcomes as acupuncture, but works a little bit more acutely than acupuncture does. So I use both of those modalities when I treat my patients just because they target the same thing, but the laser helps just a little bit quicker to get some relief in that area.
And do you use that in conjunction with like pain meds or that just that?
Yeah, so sure, it depends on the case. Some of the dogs that come to me are in a huge flare up, and that's how I initially see them. So a lot of the times they'll either already be on pain medications, or I'll put them on pain medications to get them out of their kind of crisis mode at the moment, and I'll do acupuncture and laser therapy with the hopes of weaning them off the medications. Um, there are a lot of dogs and cats that cannot take the traditional pain
Mhm.
medications, like a nonsteroidal anti-inflammatory, due to kidney disease or other underlying issues, or they just don't do well on like gabapentin, makes them look a little bit woozy. So this is a great tool to use.
We tried gabapentin and I swear it was making him woozy, but that wasn't listed as one of the side effects. That's so
Like,
interesting.
yeah, it's very rare, but I definitely have seen that
Okay.
in some dogs, makes them like a little bit woozy, a little bit like wobbly or just drooly.
Yeah.
Um,
Julie.
mhm.
Hmm.
Yeah. So if we can't use those or they just don't work well, then acupuncture, laser therapy, physical therapy, massage. I talk to my
Hmm.
clients about doing massage, even like gua sha, like body gua sha at home, because that is huge because the clients can do that every day if they want to in between sessions.
Can you expand on what gua sha is? I don't know if many people know what gua sha is.
Yeah, so a lot of people use it, and it's pretty popular right now for like facial gua sha, meaning it gets out like wrinkles and makes your
Yeah.
skin look really nice. But basically, the underlying idea is that you use a tool. It's kind of like a flat tool, and I use the tool to glide it over their fur in the direction of their fur, and it targets the underlying fascia. Fascia is this
Hmm.
connective tissue that lives underneath the skin. It coats all of your organs, it coats all of your nerves, vessels, muscles, tendons, ligaments, everything. And by using this tool, you can help decrease adhesions, you can help kind of keep it happy and less
Yeah.
tense. Um, it's hard to describe But if you
Yeah.
think about like a piece of foil, like you ball it up and it's all wrinkly, but if you take like this smooth tool, this gua sha tool, and you even out or you
Hmm.
run this tool against the foil, it kind of flattens out. And that's when it's happy, healthy, so that, tendons, ligaments, um, vessels, lymph vessels, all of that can work properly. So it's great to use at home on a daily basis, or a couple
Hmm.
times a week on your dog, just to keep everything happy and feeling good.
So in addition to joints and mobility issues in senior dogs, do you want to dive a little bit deeper on some of the other things that we should be looking for?
Yeah, so usually when dogs turn adult, so for smaller dogs, I usually say or just kind of like
Yeah.
midlife, 8, 9, 10 years old. Bigger dogs like 5, 6 years old, I really like to do annual blood work so that we can see any changes happening in any of their systems, or say, hey, this number is a little bit high. This is something that might turn into an issue. Let's change their food. Let's get them on a supplement. Let's tweak something a little bit so that we aren't running into an issue, like a big issue in the future. If they come in for an annual exam, we can listen to their heart. Is there a murmur developing? How do their lungs sound? So I'm really big into physical exam just to
Yeah.
catch some of those things. At home, if their appetite changes, if they're gaining weight, if
Hmm.
they're losing weight, if they are slowing down on walks, just kind of these vague progressive changes. If they don't want to jump up on the couch, if they do jump up on the couch, but it takes them a little bit, if they hesitate, that there's probably some pain in their
Hmm.
back or their hips that they don't want to experience, and therefore they're just kind of hesitating to jump up. Always trying to look at their teeth to see what's going on there, changes in their breath, that type of thing. If they're drinking a lot more, if they're urinating a lot more, if they're having accidents in the
What
house.
would be it? Would that be like a diabetes type of a thing, or what would it be like if they were drinking?
It could be diabetes, it could be
Okay.
kidney issues, it could be other metabolic issues like a Cushing's or Addison's. Some dogs can be hypothyroid, cats can get hyperthyroid. So again, blood work will be able to tell us a lot in terms of what does the thyroid look like, what does the blood sugar look like? Is it extremely high? Is this something that we need to keep an eye on or
Okay.
address right away? It could also just be as simple as like a urinary tract infection. And so again, that's the beauty of diagnostics, is that you can really pinpoint or rule out things that it is. If everything comes back normal, then I'm looking at, okay, if they're having accidents in the house, there could be some sort of neurologic issue. So let's go that route in terms of treatment or diagnostics.
What about like eyesight and hearing?
Yeah.
When do we like, is there anything that we can do about that, or what are some of the signs that maybe we need to have those? I mean, I'm sure there's specialists for ophthalmology. I know
Yeah.
I don't know if there's an audiologist for dogs. Actually, there probably is
There probably is somewhere. I don't know if it's like a recognized specialty, but yeah. Unfortunately, there's not much in terms of conventional medicine that we can do for hearing, and without doing like
Yeah.
specific tests or like making noise behind their head and seeing how they respond. It's hard to tell specifically with hearing. There are some like acupuncture points that we can help with hearing, if they
Oh,
have
that's
a
cool.
history of, yeah. So that's helpful with integrating both Western and Eastern. If they have a history of chronic ear infections, most likely they're going to have a um, decrease hearing abilities as they age. Eyesight, yes, there's are ophthalmologists. So, are they developing a cataracts, glaucoma? Is there something that's causing it? But yeah, just like humans, I definitely don't see as well as I used
Yeah.
to, and that's definitely changed the past 5 years. Um, so noticing, oh, does he get more startled in the dark than he used to,
Mm.
or bumping into things? Even their sense of smell can go down. So it's just taking them a little bit longer to find whatever treat is in front of them, those types of things. But just noticing that and getting it checked out if you're concerned, or just keeping, a log of like, oh yeah, he's really not seeing very well in the dark.
Yeah.
Or he gets more anxious in the dark,
Right.
and that could be a sign of that.
Do you know why that if they're prone to ear infections, they're more likely to have a loss of hearing as they age? Is that just inflammation in their chronic inflammation in their ear, maybe? Or
Yeah, chronic inflammation, damage to the
mm,
eardrum, basically just inflammation when it comes down to it. And, um, but some dogs that have like rarely had any ear issues also have decreased hearing. So
right.
again, it's similar to humans, but the majority of the dogs that have like terrible chronic ear infections do have a loss of hearing that I've witnessed in my practice.
Yeah. I wanted to touch on something that you just said about get more startled and anxiety, and that is something that I've noticed not in my own dog, but in some of the dogs that I care for. Do we know why they get a little bit more anxious as they age, or some of them at least?
So, yeah, I think it's all of those factors. So when you start to lose your senses,
Mm,
and dogs rely on their senses so much, that if you can't hear someone coming and then all of a sudden they're in their peripheral vision, that will startle them.
right,
So
right.
it's a loss of senses. We also are seeing a lot of dog dementia,
Mm,
as our dogs age. You know, um, we definitely have seen them become more anxious, because they can get confused. Some dogs have sundown syndrome or sundowner syndrome, where when the sun sets, they get a little bit more anxious. I honestly don't know the mechanism of that. It's derived from human medicine. I always talk about like melatonin and doing acupuncture and other ways to help relieve that, but that can bring about anxiety. If they're unable to move as quickly, or they're unable to
mm,
use the stairs, or they're nervous about slipping on hardwood floors, that can cause them to be anxious and frustrated, as well. Or I assume frustration, I'm just, assuming that, but that can increase anxiety also. So, kind of all of those factors, just like feeling off, not having their senses as sharp as they once were, a little bit of dementia, all of those factors can play into that increase in anxiety.
What are some of the things that we can do to help support that? I mean, I would assume like putting down mats,
Mhm.
all the things, and not startling them on purpose,
Yeah. Yeah. So for mobility, like yoga mats, there's a dog grip socks or dog booties, making sure they have a place where they usually walk, just like rugs or some good footing. Yeah, trying to make them aware of when you're approaching them, or if it's nighttime, you can put
Hmm.
in little like night lights if they, kind of wander a little bit throughout the house, making sure that there's no underlying cause. So pain, nausea, again,
Hmm.
just not feeling great, that could make them a little bit more anxious. And so just making sure that they don't have some
Hmm.
underlying issue or disease, that we could help support them with. Sundowners, I talked about melatonin.
I didn't know you could give melatonin to dogs.
Yes, it's a specific dose depending on the weight. So talk to your veterinarian about that. I really like Elevate Sciences. They have a CBD product that also helps with joints.
We just started that. Yeah.
Oh, tell how has it been?
We are like 4 days, 4 or 5 days in, and we're doing the oil because it's supposed to help with the oil drops, and because it's supposed to help with it's the pain and then also anxiety and itching. So he has
Yes.
all of those things.
Yeah.
So yeah, he's doing. I mean, seemingly doing great. I mean, he's definitely sleeping through the night now, which is very helpful for me. And it's making him a little bit more zen, and I might lower the dose a little bit just because I don't want him to be super zonked out.
Yeah. And usually the first week, I believe, is sometimes it's like double the dose and then you drop it
Yeah.
down. And Elevate, they're really good about talking with people, if it's too much, if it's too little, about like tweaking the doses a little bit. And so that's super helpful. Pain, arthritis pain.
Oh,
But that is something that I reach for if I have a client that has
yeah.
all of those things. So anxiety, pain, and again, itchiness. They just, completed that study on it, which I think is fantastic.
Yeah.
Um, so that can be super helpful, because there's so many herbs and supplements out there. It's like they could be taking like 5 or 10 supplements, but a lot of dogs don't want to take supplements or like take pills or anything. So that can also turn them off of food if they're not into their medicine or supplements. They could turn their nose up at food if there's just too much in there.
Yeah, that makes sense. Mine started taking his herbs out and putting them on the floor before he
Yeah.
eats.
Yeah.
So I wanted to talk a little bit more about nutrition and if there's a few things that we can do to help to just kind of add to our senior dog's bowl that might be helpful just to give them a little boost.
Yeah, I'm all for fresh food. So if that means, topping your dog's kibble with like cucumbers, melons, steamed veggies, that type of thing, it's super nutritious. It can, feed their good gut bacteria, which will help with digestion and
Right.
immune support, all of that. So I'm all for fresh food. There's some great diets out there, like Just Food for Dogs. Bottom line, I'm all for that. With dogs that have certain issues, you want to be careful about what you're feeding them, especially if they have like, kidney or liver or other specific ailments or diabetes. But usually, if everything is fine, I don't like to decrease the protein. A lot of people say that you should decrease the protein as they get older, but they lose muscle mass just like humans as we age. And I want to make sure that their muscles are working so that they can continue to have great mobility. Unless there's a specific reason, I don't like to decrease the protein in their food.
Why do they recommend decreasing the protein? Because I have heard that.
Yeah, I think it's more just assume that like, the kidneys aren't functioning as well and therefore they can't process the kidneys as well. But if everything is working fine and the dog is, tolerating it, again, it's just a case by case basis. But that is one
Right.
recommendation that I want to say, like, let's keep the food as is until we absolutely need to change it. Again, fresh food is my personal favorite. Probiotics is a great thing to add. It helps with digestion. A lot of older dogs don't digest their food as well, or they just have a more sensitive stomach. So, like Visbiome or Proviable or Just Food for Dogs actually has a probiotic as well, just to maintain their health. If they can't chew as well, then if you can't do fresh food, then canned food is a fine alternative, or doing bone
Mm-hmm.
broth. So they're kibbling a little bit of bone broth. Bone broth is also good for joints and GI health,
Mm-hmm.
so that's really nourishing as well. But again, I really just stress fresh food, and
Mm-hmm.
then depending on case by case, we can tweak the diet a little bit as needed.
The bone broth for dogs. I'm going to leave out the onions and the spices, right? Yeah.
Exactly. Yeah. Yeah. And there's a lot of good dog bone broths on the market. So
Yeah.
there should be plenty to choose from, hopefully.
I have a few senior dogs that they're doing great, but their mobility is really struggling. They're getting to a point where, they can't get up on their own, or in one in particular, he can't get up to go to the bathroom on time by himself,
Mm-hmm.
right? But other than that, he's doing great. Like he can still go on like short walks and, very short walks, like outside and down the block and back. He can't, so he's essentially soiling himself,
Sure.
Because he can't get up. He can't get it to, there's a disconnect between when he needs to get up. He's incontinent, but when do you know when that quality of life or that pain is so in a place that
Mm-hmm.
we need to think about other options,
Sure. Yeah. So when I talk to clients, again, it's very much an individual case by case basis, but in general, I say think of 3 things that your dog or cat loves to do, whether it's go for a walk, gets excited when you walk in the room, eats,
Yeah.
plays with his favorite stuffed animal. Think of, 2 or 3 things, because sometimes there's not much if they're older. And if they stop doing those things, if they don't get excited when you walk in the room, a lot.
Yeah, that's a big one, I think.
Yeah,
Yeah.
for a lot of dogs, if they stop eating, although some dogs will eat until the very end, so that's kind of a hit or miss marker. If you can get them up, with a harness or going out in the stroller for a walk, and they're just not engaged, or they just are seemingly
Yeah.
depressed, if they're soiling themselves and they get like a urine scald or an infection of the skin, that's when I say, we need to look at their quality of life. And is it time to say
Yeah.
goodbye? Or is there, in Chinese medicine, we call it shen, so like their spirit. If they
Yeah.
still, have like their spirit and they're excited when you walk in the room and they love to go in their stroller, or if you can get them up and, I use the help them up harness to help walk essentially older dogs. And if they can still get excited about that, then maybe they still have good shen, or maybe they still have the happiness they had their whole life. So thinking about 2 or 3 things that they love to do, and if that decreases, then it's something to think about in terms of saying goodbye. Also charting good days and bad days, and people can do this however they want. If they want to do a scoring system, or like thumbs up, thumbs down, like was it a good day or a bad day? And if they're having more bad days than good, then again, it's do we need to think about humanely
Yeah.
saying goodbye to them? It's tough, though. I mean,
It's super tough.
it's so hard, and there's no right answer. And
Yeah.
I just try and support my clients through any decision that they make,
Yeah.
and help guide them, but also be an advocate for the animal as well.
Yeah. Yeah. I love how you put that, if their spirit, like if their spirit is the same,
Yeah,
then you just kind of have to figure out how to manage the situation.
exactly.
Like a doggy diaper, which nobody wants, but
No, but
if their
if
spirit is
that's the
there,
case,
yeah.
yeah,
Yeah.
and if they can still get up, like you said, to go for a walk, it's a short walk, sure, but if they're still excited about that and sniffing things and
Yeah.
excited to, see other dogs, then yeah, a doggy diaper, laying on pee pads. My old dog, who I adopted as a senior, he towards the end, or at the end, like I just put a pee pad in his bed every night because I knew
Yeah.
something was going to happen.
Oh, that's
But he was,
smart.
yeah, he was still so excited to go on his walks. Like I had a stroller for him. I had to help him up harness, and he would like try and run. He physically couldn't, but he was just so excited. But then the day that I knew he was done was that he just was not excited about
Yeah.
anything. He refused to eat, and so I knew that it was time.
Yeah.
But it's hard to come to that decision.
Yeah. I remember one of my clients that many moons ago, he would get so excited. I knew he was a senior. I think maybe at that point might have been like 15, but I came for him one day and he was sitting in his favorite spot and he looked at me, but he didn't wag his tail. And I was like, yeah,
Yeah.
I'm not taking you
Oh,
for a walk
yeah.
today. Yeah. And
Yeah.
then he knew, but it was only a few hours later that he passed in his favorite spot, staring
Right.
at his favorite tree
Right.
and all the things. But
Yeah.
I knew
Yeah.
then. I was like, okay, yep, you have other
Right.
plans. Yeah. If you have anything that you want to add for pet parents, they're just kind of starting to embark on their senior dog journey. I think
Yes.
patience is probably a
Patience, and don't be afraid to change your routine into something different and that works with your family.
yeah.
Again, my old dog Lenny, I got him
Mhm.
when he was senior, but I could tell that he was like part Jack Russell, so I could tell that he would just like probably run on leashes. But having a stroller or a wagon,
Yeah.
um, like he was so excited. So it was like,
Mhm.
all right, well, that's his new routine. And if we did go for a walk, it was maybe like half a block, but he smelled everything and we took our time. So it was just different. So yeah,
Yeah.
don't be afraid to change their routine, because you can still get a lot of quality life in their golden years. Raising food and water bowls, putting yoga mats down, that can help navigate their environment.
Mm.
And it can just be like small changes, and they can be a lot happier, and you guys can still maintain that
Yeah.
human animal bond. Hopefully that will help.
Yeah. Go with the flow of it.
Yeah.
Well, thank you, Dr. Tori. This was great. This was great.
Yes, thank you.
Thanks so much for joining me for another episode of the Baru Podcast. Just a reminder, you guys, this podcast is for informational purposes only, even if it features the advice of veterinarians and trainers. It is not, nor is it intended to be, a substitute for professional veterinary care. Do you have a behavior question, a health question, or a story of canine companionship you want to share with us? You can email me, Charlotte@thebaru.com, or call our new Baru phone number, 424-273-5131, and leave me a message. And don't worry, if you don't have a pen handy, you can find the contact info in the show notes. All right, let's chat next week.